Hello, everybody. Welcome to our 2023 Self-Direction Virtual Conference Series. Thank you so much for joining today's session. My name is Molly Morris. I am a Vice President at Applied Self-Direction, and I am thrilled to be presenting today on FMS Providers' Perspectives on EVV, Electronic Visit Verification, Best Practices for Self-Direction. But before I get into the topic at hand, I just want to go over a few quick housekeeping issues. First, your microphone has been automatically muted due to the volume of attendees, the number of people joining us. Please remain muted. You can submit your questions and comments at any time during the session by using the Q&A pod in the lower left-hand corner of the Adobe Room, and I really would love to hear from you. We have time reserved at the end of the session for your questions, and all questions and comments will remain anonymous, and we'll get to as many of them as we can. And finally, closed captions for the entire conference series is available courtesy of our premier sponsor, Avero. You can access the closed captions by clicking on the CC icon at the top of the Adobe Room. So now that we've covered all of that, let's talk about EVV. I know this is a topic that many of you are care a lot about and have a lot of interest in. So we have a lot to cover today. So I am going to be kind of the sole presenter today, starting off by giving you some background on how we developed a new report. You can actually see a link to that report in your room. We're giving you early access. We're going to be sharing this more in the next week or so more broadly. But I'm going to share some background about this report, specifically on electronic visit verification. I'm going to refer to as EVV throughout this presentation. EVV best practices for self-direction, specifically recommendations from the financial management services industry for states and managed care organizations. But also, I notice there are a lot of people in the room who aren't necessarily from a state or an MCO. Maybe you're a support broker, you yourself self-direct. Whatever your role is in kind of the self-direction universe, I think this report is going to be a helpful resource in terms of being able to make recommendations to states and MCOs in terms of some positive best practices to make self-direction work with EVV. And of course, if you yourself are an FMS, you very likely contributed to this report and will be able to use this report and the findings from this collective guidance to inform your work with states and help give them some information on best practices. So I'm delighted to get into that. I'm really going to spend most of my time today really going into in-depth the findings of this report and some of the recommendations that we heard from financial management services providers. And then again, as I mentioned, I'm going to leave some time for questions and comments at the end. But before I dive into really talking about the report, I just want to give some quick context about EVV, electronic visit verification. Depending on what's going on in your state and your given role, you may be more familiar or less familiar. So I just want to make sure to set the foundation that the 21st Century Cures Act is a piece of federal legislation that requires states to use EVV for any Medicaid funded personal care services. So this includes self-directed personal care. So this isn't something that any one state just came up with. This is a federal requirement. And actually, states that don't comply with this requirement will receive a reduction in their state's FMAP, or their federal Medicaid assistance percentage. Then that's kind of counted per quarter. So, states will reduce the amount of funding they receive if they don't comply with these requirements. And any future changes to this requirement of EVV would require federal congressional action. So, today's conversation really isn't about what I see. My sound is muffled, so I'm going to try to improve that a little bit, but people can let me know if I'm not sounding better. In order for EVV to not be required, would require this congressional action. But what we're really going to talk about today is what are some things that states and managed care organizations can do, drawing on recommendations from financial management services providers to make EVV work better for self-direction, knowing that this is a requirement that probably isn't going anywhere, particularly anytime soon. Also, the baseline recommendation or the baseline requirement for EVV systems is that they must verify the following: the type of service performed, who received the service, who provided the service, the date the service was provided, when the service begins and ends, and the location of service delivery. So these are, the baseline requirements. But states do have, some discretion in terms of how they design EVV and some choices they can make. But it's important to know that these variables are going to need to be tracked. And then finally, because we're going to really be talking about the FMS provider perspective specifically, I think it's important to point out that FMS providers in most cases are playing a lead role in implementing EVV and self-direction. They're really the boots on the ground, working with self-directing employers and workers to help get this going in self-direction. So they really do have a unique on the ground perspective of the specific operational challenges presented by EVV. Of course, every stakeholder in the process has an important perspective. But for the purposes of today's presentation, we're really focusing on what FMS providers are saying about how to make EVV implementation work better. So now I'd like to really jump into talking about this new report that I'm giving you a sneak peek into what we have learned and what we are presenting. So this new report was developed by the National Self-Direction Policy Workgroup. So this is a group that is comprised of financial management services entities who have really come together, committed to advancing self-direction through collective action. Across all the different FMS providers that serve self-direction programs across the country, we certainly find that they tend to encounter common issues and can really make important changes when they come together to identify operational issues and so forth. So that's what this work group is really all about. And they identified EVV as a very important area where they could come together around collective action. This work group is convened and facilitated by Applied Self-Direction, so our team, as part of our larger national FMS membership offering. So if you're an FMS member with Applied Self-Direction and you're thinking, oh, I didn't know about this policy work group, you're always open to every FMS member to participate. So please don't hesitate to reach out if this is something that you want to be part of and you had kind of missed the memo that this is an option. I just want to make it very clear that the concept and approach for this report that I'm going to be sharing the results from was really developed under the leadership of this work group. I am really the messenger here, sharing what our EVV industry is saying about how self-direction is going with EVV and what their lessons learned are. And really, the purpose that was identified by this work group was really wanting to pull together collective wisdom from the FMS industry on what lessons have been learned about implementing EVV and give some guidance to states and MCOs that are wanting to improve implementation, knowing that there is some leeway. While there is a federal requirement to operate EVV, states do have choices, and FMS providers have some opinions on how they might want to make those choices. So how we captured the FMS perspective on EVV, obviously we're pulling together a lot of different FMS providers who each have their own nuanced opinion on EVV, their own experiences, but how did we kind of come up with the common themes across different FMS providers? We started by distributing a survey to all FMS members back in November 2022. And we were really looking at how different FMSs were involved in implementing EVV, what approaches were they using, what was the status of EVV implementation. Some states are quite far along in using EVV and self-direction, and some are still kind of getting things off the ground. So hearing the different perspectives people were coming from, and really exploring in that survey primarily what the FMS industry has seen in terms of both positive and harmful outcomes of EVV for self-direction. We use the findings from that survey. By the way, that survey really was designed by this policy work group, and they informed what questions we were asking. The findings from that survey helped inform then further follow-up in a two-part focus group series with FMS members. All FMS members were invited to really discuss the challenges and best practices for EVV implementation. And those sessions were held in December 2022 and January 2023. So all the feedback and insights I'm going to share with you were all discussed relatively recently. The first focus group session we did really talked a lot about kind of the ticky-tack and technicalities and operations of EVV, looking at things like the status of implementation, what the workload of implementing EVV looks like for FMS providers, where there are some improved efficiencies, what it's like working with data aggregators, and also the different EVV models and systems and comparing and contrasting them. And then session 2 talked a little more broadly about what have the FMS providers heard from people who self-direct about their own experiences with EVV. And as we'll talk about, we do hear a lot of dissatisfaction on the participant side, as well as issues related to getting access to the appropriate technology for self-direction and EVV, what folks think about allowing living caregivers to either be exempt from EVV or to require EVV, how EVV has impacted the workforce crisis in self-direction, how it's impacted the quality of self-direction, and also what's it doing in terms of actually preventing fraud, which is sort of the named purpose of EVV, is one of the primary purposes is to really attempt to prevent fraud. So what FMS providers think about how that's going. So I would be absolutely remiss if I didn't take this opportunity to really acknowledge the large universe of FMS providers who contributed their wisdom, expertise, and insights for this report that I'm going to share the results. Again, these are the folks that are really came up with the ideas that I'm going to be sharing, and I am just the messenger, but I really want to acknowledge the leadership of all of the FMS members who have participated in the policy work group and or were part of the focus groups that have informed this report. And to those of you who may have been part of developing this report, please don't be shy to make your comments known and ask, share your thoughts on everything that is coming out of this report. With all that said, let's actually get into talking about what the FMS industry has to say about EVV. And I'm going to start by looking at what was identified as the top challenges and the top potential benefits of EVV implementation for self-direction. And were definitely some common themes. So the first major challenge that we heard from FMS providers was that EVV implementation has been very challenging for most FMS providers, particularly in states where they need to partner with an external vendor who may or may not have a formal relationship with the FMS provider, where they have to submit data to an aggregator, again, where that aggregator may or may not be familiar with self-direction or have a connection to the FMS provider that's contractual, and in situations where the FMS has to follow unclear or unrealistic policies and timelines from states or MCOs. And that has really informed the challenge. Throughout this presentation, I'm going to be pulling in some survey results and some quotes from the focus groups and the survey that we did. So the first one I have here is, we asked the FMS members in a focus group, how is EVV implementation going in the states you serve? And 82% said it's challenging, while we do see there is that 18% that's going well. So you'll see there's a theme that there is a small percentage of FMS providers that are working in states where there has been some success for EVV. So I think that's a great reason for some optimism that we can build on the findings of this report to hopefully improve circumstances in some other states as well. But certainly we heard that this has been a true challenge. Another top challenge is that EVV has increased the administrative burden and cost for FMS providers, who in their role, are really responsible for providing the technical support, training, and communication to participants and workers on EVV, and are often in the position of having to deal with the different system glitches that can come up, responding to data errors and compliance issues. So this has really added to the workload of FMS providers. And I think it's really notable. You can see in a focus group, we asked, do you work with any states or MCOs that have successfully helped address the increased EVV workload for FMS providers? And the response was 100% no. And knowing the comments that were made in these sessions, I don't think that's to say that states and MCOs have not attempted to address this increased burden. I think there are some great examples of this taking place, but that the burden is so great that I think there is a lot of room to grow in terms of resourcing FMS providers appropriately to meet the level of work that comes with implementing EVV. Another major challenge is that FMS providers noted that EVV has caused participant dissatisfaction, anxiety, and confusion. This is particularly seen among live-in caregivers for whom it is difficult to try and fit within the structure of tracking hours in a linear way when, the care provided can be very much 24/7. Also been difficult for family members, older adults, and really anyone who has limited access to technology, internet, or isn't receiving the appropriate language options, and has caused issues with direct care staff attrition in some cases as well. So we did ask in the focus group, FMS providers, from your perspective, has participant dissatisfaction with EVV improved in the last year? 69% said no, that's the majority, but we do see 31% say, yes, there has been some improvement. And I will say, again, this theme of a little bit of positive here, I know some FMS providers really are hearing that some folks like EVV, and we'll talk a little more about that. I've also heard directly from some participants who do like some of the efficiencies of an EVV system. So it is not universally disavowed, but clearly there remains a lot of resistance, opposition, and unhappiness about EVV. And then the final top challenge that really emerged across the feedback from all the FMS providers was that many folks feel that EVV has not improved the quality of self-directed services or even prevented fraud significantly, and may actually have eroded the flexibility and autonomy of self-direction. So really, we heard some major concerns about, is EVV even doing fulfilling its intended purpose to prevent EVV? And is it taking away from the important philosophical features of self-direction, of real choice and control? So again, looking at our focus group, we asked what has been the impact of EVV overall on the quality of self-directed services, and 89% said there's been a negative impact. Of course, this is going to be interesting to track over time because we're very much in many states in the midst of EVV implementation. But we are seeing, again, that little hint of positive. 11% said there has been a positive impact. And then asking specifically, has EVV improved fraud prevention efforts? 57% said no. So, that's a smaller majority, but certainly some concerns there. 14% have seen some effectiveness, but then 29% are unsure. And I certainly think something we heard was that it is just not yet clear if EVV is going to kind of do what it was intended to do in terms of fraud prevention. And we are still early enough in many states that it makes sense that some FMS providers just won't quite know yet. So, speaking of this positive thread, let's talk a little bit about what the FMS industry is seeing as potential benefits of EVV for self-direction. And again, these are just some common themes. All FMS providers had some different perspectives. But some of what we heard that might be working well in some states is one that, it's providing a convenient and secure way for workers to record their time and tasks electronically, really reducing the paperwork burden and the number of errors. And you can see I have a quote from one of our FMS members saying, "We have a lot of people that enjoy using the EVV software system and like not being tied down to a piece of paper. Budget details at their fingertips, no overlapping shift issues between staff." So there are, certainly a fair number of people who like the, you know, paperless mode. Additional benefits, EVV really is enhancing the transparency and accountability of service delivery and allows both employers and the FMS to monitor and verify the quality and the quantity of services. So really, having more access to information about how things are going. And then FMS folks also pointed to EVV really improving the efficiency and accuracy of payroll and billing processes. So reducing administrative burden and payment delays. So I feel like efficiencies was kind of the biggest headline, I would say, of what FMS members were saying was going well or had the most potential. All right, additional benefits that we heard. EVV is offering data and insights to inform program evaluation and improvement, such as identifying service gaps, trends, and best practices. EVV is also enabling workers to use their own devices or other available options to log in and out of their shifts, making it easier and faster to submit their time. So for folks who do have a cell phone or for whom it's convenient to log time in this way, it's working quite well. And then an additional benefit, giving employers more control and visibility over their workers' schedules and activities, allowing them to approve or reject shifts and track their budget. And again, I think it's important to acknowledge that each state and each program within a state operates very differently and had their own, distinct approaches to tracking time even prior to EVV. So some systems had a lot more room for improvement, whereas some systems might have been working well, and this is an unwelcome change, but we are hearing some of this positive. And just from one FMS member who said that, when an employee is able to successfully log in and create their time entries in EVV, it eliminates issues such as over budget and overlapping times. So we are hearing some reports of some of these improvements. And then finally, a few more. Some FMS providers see EVV as streamlining the communication and coordination between the worker, the employer, and the FMS. So all these different parties kind of being able to be a little better on the same page, and facilitating timely and accurate information exchange and feedback. Some FMS providers are seeing EVV as I mentioned, there's a smaller percentage that see EVV as protecting workers and employers from potential fraud and abuse, ensuring that services are delivered as authorized and agreed upon. As one member said in a focus group, it has minimized fraud and allows for real-time data. Again, we've heard a different message from many FMS providers, but some are seeing this benefit in certain states and situations. And then finally, some folks see EVV as providing valuable information to measure and improve the outcomes and satisfaction of self-directed services, such as worker retention, quality of life, and cost effectiveness. And really, the potential to be able to measure outcomes is important for really being able to make the case for additional funding for self-direction and getting additional support. So that's a really interesting benefit to see that some folks are finding. So let's really get into the specific recommendations from the FMS industry for states and MCOs on how we can make EVV implementation work the best it possibly can for self-direction. One major theme around areas for improvement and best practice is stakeholder engagement. I think we definitely heard from FMS providers that really effective, strong stakeholder engagement is needed in this process. And stakeholder engagement, I'm really talking about involving FMS entities, people who are self-directing, their family members, their workers, early in the process and often in the planning, implementation, and evaluation of EVV, and to really meaningfully ensure their representation and input is included in policy and decision-making processes. I think, what we really heard from FMS folks is if you leave out the perspective of these stakeholders, problems are going to catch up with you down the road because you didn't hear that important feedback about how this needs to look in a self-direction context. Additionally, there is a really important need to establish clear and consistent communication, training, and support for EVV users on EVV requirements, expectations, and options. I know we make it sound so easy. This is a complex, challenging thing in states where there are so many moving parts and people and stakeholders, but this clear communication is what FMS providers have reported has been really important, where they have seen some successes. And one FMS member had said, self-direction is often not considered at the start of the state implementation. Once these decisions are made by the state and the state elected aggregator, it's often too difficult based on the timeline for them to reconsider a different approach. And we really have heard this time and again that in states that have gotten things off the ground with EVV and not involved considerations for self-direction, it then becomes very hard to go back and make things fit. Some other recommendations for stakeholder engagement: FMS providers really emphasize the need to provide accessible and user-friendly materials and tools in multiple languages and formats. It's going to be really hard to learn to use a new technology system if the instructions are not written in a language that you are familiar with. How will you even begin? And FMS providers certainly reported that they have seen many scenarios where these materials are not available in a way that's accessible to all users who will need this information. FMS members also talk about ensuring that EVV systems and vendors are reliable, user-friendly, secure, and compliant with privacy. We know privacy is huge, and accessibility standards, and that they do not limit or restrict the location or type of services provided in self-direction. In an effort to try and meet the requirements, there can be a tendency to put some technology systems in place that artificially or unnecessarily restrict community access, and that's absolutely the opposite of what we want to see. As one FMS member said, accessibility of the EVV option should be a top factor in vendor choice. Most options we viewed are not intuitive and do not have accessibility features or different language choices. We need to keep in mind the populations we serve and make decisions with their well-being at the forefront. Couldn't say it better than that. And then some final best practices specifically for stakeholder engagement is FMS members recommend offering flexibility and choice to participants and workers on how to use EVV, such as allowing them to use different devices, methods, or vendors, or granting exceptions or exemptions for certain situations or populations. And we'll talk a little bit more about that coming up in some slides as well. FMS members also recommend really monitor and evaluate the impact of EVV on the quality, satisfaction, and outcomes of self-directed services. Is EVV harming self-direction? If so, what can we do about it? And really look at addressing any issues or challenges that arise in a prompt and collaborative manner. Don't let this stuff slide. Really address it head on when it begins to arise. Something that was really a common thread across FMS providers. And then another FMS provider said, we've seen significant success with a combination of a use of federal programs to provide cell phone when needed, but also the state and FMS allowing for the use of a mobile app on a smartphone or tablet or landline. And this is very reflective of a lot of comments we heard about, having a variety of options being critically important. So I'm going to switch gears here a little bit and talk about what FMS providers recommended in terms of the policy choices that states and MCOs are making about EVV. What do FMS providers think about what these policies should look like? So I mentioned earlier in the presentation that states are able to choose whether or not to exempt live-in caregivers from EVV requirements. So we asked FMS members, what do you think should happen? What works best? You work in states where it's exempt and not exempt. What do you recommend? And the takeaway was, for the most part, our FMS members really recommended exempting live-in caregivers from EVV requirements, or at the very least, simplifying and streamlining the process for live-in caregivers for them to submit and verify their time worked. Knowing, as I mentioned earlier, the kind of 24-hour nature of the role of many live-in caregivers for whom it's quite difficult to hone in on specific hours of time to bill for. We did ask, um, in our focus group which approach FMS providers preferred. And as you can see, 83% preferred to exempt live-in caregivers. Nobody actually expressed on that focus group a preference for requiring EVV, but 17% had no preference and kind of open to both. And according to one FMS member, we hear the most pushback from people with live clocking in and out and using the GPS. We feel that live-in caregivers need to put their shifts through an electronic system, but that they can create a shift after it has happened and not have to have the GPS on. So this really speaks to, okay, if you're still going to require it for live-in caregivers, maybe we make it a little simpler. And that's one example of that. Another area of recommendation on actual EVV state policies is FMS members, again, just to really hammer this home, recommend offering multiple options and methods for EVV participation, including mobile app, web portal, landline, fixed device, or manual entry, and ensure they are accessible, user-friendly, and again, available in multiple languages and formats. Make it so we meet people where they are, they get the information that they need. One example from an FMS member is they said, in our state, telephony is an option, but is only for the employee to clock in and out hours, but not for the support manager to approve the hours. So it doesn't address the technology barrier for them. So again, really scrutinizing, okay, are you really offering options as thoroughly and completely as necessary to make this accessible and workable for all of the different people that need to interface with the EVV system? Some other EVV policy recommendations. FMS members suggested establishing clear and consistent policies and guidance on EVV requirements, expectations, and timelines, and to communicate them effectively and frequently, more than once, many times over, to all stakeholders using multiple channels and formats. There was a real theme from our FMS providers saying that it's so important to have messages come from many, many different avenues because you'll reach more people, and you can't just be one and done. FMS members also talked about the need to ensure all policies are established and communicated early enough to allow for adequate testing time prior to implementation deadlines. We heard a lot about just really not getting sufficient notice and time to work the kinks out. And really noting that stakeholders' feedback should be requested to ensure ample time exists. So to really ask stakeholders, FMS providers, people who are hiring their own workers, how much time they need to be able to comply with the new policies and procedures. As one FMS member said, it would be more helpful if the MCO and state are more organized in the rollout and aware of the amount of time it takes to roll out. Some of the timelines given are just not thought through. And I thought that was important feedback. Other recommendations for EVV policies, provide adequate funding, support, and training for EVV implementation, including covering the costs of devices, internet, and technical assistance for participants and workers who need them. People aren't going to be able to be compliant if we don't give them the tools they need in order to be compliant. Specifically, multiple FMS members really pointed to the importance of allowing for payment to workers for their time spent on EVV training. You can imagine somebody self-directing in a marketplace that is so tight, the difficulty of finding workers. You bring them on, and the first thing they have to do is fulfill requirements they're not going to get paid for. makes it a lot harder to compete and keep that worker retained in order to actually provide that critical care that the person is seeking. One FMS provider had noted the state is not allowing participants who need to use EVV to purchase a device for their workers to use with their program funds. So again, really looking at, are we providing the tools and resources for every person who's part of the EVV requirements, the resources they need to be compliant? And then a final recommendation for handling EVV policies. FMS providers talked about establishing reasonable and realistic compliance thresholds and exception policies that recognize the diversity and variability of self-directed services. And very importantly, not to penalize or disenroll program participants or FMS providers for minor or unavoidable errors or difficulties with EVV. Recognizing that people need support and need to be given some leeway for making mistakes. And one FMS member said, yes, go in phases and hopefully allow exceptions where it makes sense. During a workforce crisis, it's so important not to add barriers for people trying to use services. Very important. All right. FMS providers also spent some time talking to us about best practices for collaborating with them. What better experts than FMS providers than to tell us how best to work with them? So FMS providers talked about asking that states and MCOs really consider that the technology needs for EVV systems are different in a self-direction context versus an agency context. So for example, common EVV system requirements on the agency side, such as scheduling, scheduling hours and having attestations, are just not aligned with the philosophy or the practicality of how self-direction works. And this can cause really unnecessary restrictions and burden on the participant and their worker. So is your technology kind of pre-wired in a way that strips some of the flexibility that is just an integral part of self-direction? And one member put it really well, consumer-directed participants are very different from traditional agency workers, and their differences aren't considered. Definitely need to give consideration to those differences, and they need to develop and define EVV very differently for those two populations. More best practices for working with FMS providers. They talked about allow FMS providers to have a choice of vendor, a hybrid system, or an in-house system that supports integration with their portal and payroll processes. Additionally, allow FMS providers to choose or develop their own EVV system that meets the federal requirements and supports integration with their existing systems and processes, rather than mandating a single state or MCO vendor that may or may not suit the needs of self-directed programs. So again, going back to EVV looks really different in a self-direction context. So let's give the FMS provider some flexibility to make it work in this specific context. One FMS provider had said, seems that a lot of the expectation for execution and compliance comes down on the FMS provider, but not all states and MCOs allow for the FMS entities to have the flexibility to select and partner with EVV vendors that may function well with their systems. So if you want FMS providers to have some success, give them some leeway in what the tools look like so they can make sure they're well set up for success. Another really important recommendation is to provide adequate funding and reimbursement for FMS providers to cover the costs and workload associated with EVV implementation. As we talked about earlier, it's been significant. This includes, the staff training, technical support, data reporting, and compliance monitoring. I thought it was really striking that one of our FMS providers noted that, increased rates for FMS. We had ours reduced in 2022, even with EVV implementation being demonstrably burdensome. So you can imagine that if you're not paying appropriately for a given service, there's going to be quality issues that will result if there's not appropriate compensation. A final recommendation for collaborating with FMS providers is to really provide FMS providers with accurate and updated technical specifications and guidance on data submission and validation, and notify them of any changes or issues promptly. Ensure those technical specifications are applicable to self-direction. So really giving those FMS providers time to be responsive to these technical specifications. One member said, make sure the specifications that are given to the FMS are correct. We were provided specifications that were not correct, which required programming and then reprogramming for the aggregator. And what all this then ends up meaning is that it's more time and for a person to be able to pay their worker, and can trickle down and to create some real issues in terms of accessing care and being able to retain staff. Importantly, our FMS providers did talk specifically about what it was like to partner with data aggregators. So, just for context, in many states where there are multiple EVV systems, they all need to, all the data these different EVV systems are collecting need to kind of be combined and submitted to the state. So many states are contracting with these third-party data aggregators who all, the different EVV vendors submit their data to, and then that aggregator combines the data, does what it needs to, and gives it to the state. So we definitely heard from FMS providers some challenges in making the connection between self-direction and the EVV data collected through the FMS to then bubble up through the aggregator. So some of the recommendations that we heard, one is to involve FMS providers in the selection, contracting, and oversight of aggregators, and solicit their input and feedback on the performance and functionality of aggregators. So don't do this in a vacuum. We really want these different parties and stakeholders to understand each other and be able to talk to each other, and for FMS providers to have some opportunity to make sure considerations for self-direction are baked into what the aggregator is doing. Also, establish clear and timely communication channels and protocols between FMS providers and aggregators, and designate a point of contact for each party. So really making sure there can be some clear communication. We certainly heard a lot of reports where FMS providers were having a hard time getting responsiveness from the aggregator specifically. So here's an example from an FMS provider. If we are sending EVV data, again, it's important to start early and engage with stakeholders to educate the state and state elected aggregator on why self-direction is different than traditional provider agencies. Tech specifications to send data often change, and we are not notified proactively. So again, this can really trickle down to have some serious results for, at the end of the day, for the person who's self-directing. Another recommendation for partnering with data aggregators is to really ensure that data aggregators have the capacity, expertise, and technology to handle and process the data from FMS providers efficiently and accurately, and to resolve any errors or discrepancies quickly. I mean, I was talking earlier about how EVV can look very different in a self-direction context versus an agency context. You can imagine if the data aggregator is really only set up to work with the agency side, there are going to be these data issues in making a transfer from a self-direction context bubbling up to the aggregator. So as one FMS member said, in my experience, the contacts at the state and or MCOs that we work with on a daily basis are far too separated from detailed EVV knowledge. This often means that when we try to engage with them or the state aggregator, we are stuck. The state aggregator defers to the state, whereas the state contacts don't understand how all the parts work together, and where there is a disconnect may be leading to aggregation problems. So again, really having the FMS provider at the table to help make all of these different variables more well understood is going to be very important. And then our final recommendations on best practices for partnering with data aggregators. Very soon, I'm going to be turning over to your questions and comments. So please feel free to start submitting them. Would love to hear from you. I see some have already come in, but some of these final recommendations, FMS providers talk about the need to align the data elements and formats required by aggregators with the data collected and stored by FMS providers, and really minimize any duplication or inconsistency of data entry or reporting. Again, there can just be real messiness when there isn't a good fit between the data being collected to where it needs to be submitted. And then allow FMS providers to test and verify their data transmission and aggregation before going live, and provide feedback and support to address any problems or gaps. We really heard again and again from FMS providers that issues do come up, and you do need that time period for troubleshooting to really understand how to make this go smoothly. So when the time comes that a higher degree of compliance is required, everybody's ready for that change. And one FMS member said a billing payment can be denied if there is not a matching line in the aggregator. So again, just really underlining the importance of making these systems work so people get paid on time, so participants can retain their workers, and so we can just keep all the trains moving on time. So with all of that said, I have covered the main key takeaways and themes and recommendations from this forthcoming report that I think are really important to share. I think it's worth noting that this report is really a summary of the survey and the focus groups that we did with FMS providers, and the full kind of we have full reports of the survey findings and the focus groups as well. So you can really drill down and see a lot of details about what we heard from FMS providers. So let me look at some of the questions that have come in. And again, please don't be shy to share your comments. If you're an FMS provider, did we miss anything? Do you have questions that you'd like to hear more from FMS providers? Please let me know. This looks like more of a comment. In our state, EVV has created more overlapping payment issues. And I think this comment came in. I think this comment came in earlier when I was talking about some FMS providers were seeing improvement, but obviously every state, every program is going to have a different scenario. And it makes sense that you are seeing, in some instances, more issues. Let me see. A question, has there been any concrete proof that EVV has decreased Medicaid fraud at this point? How would that even be measured? Good question. Um, you know, I have certainly not seen any specific proof, so to speak, that EVV has decreased Medicaid fraud at this point. I think one way to potentially measure it is to be looking at, and I don't know if this is really happening systematically, but to be able to document any instances where the EVV system has captured potential fraud. I think it's also important to note that how we define fraud is very murky, and that makes it hard to measure and define. We find in self-direction what might be considered fraud may more fairly be referred to as unintentional fraud, where somebody doesn't understand the program rules, and really being able to distinguish when does EVV capture those types of issues versus someone who is really maliciously looking to work the system and get money that they are not owed. But I think there's a lot more room to better understand the effectiveness of EVV, as well as the cost of implementation versus the amount of money that it's potentially saving from fraud prevention. And that's something that hasn't been particularly well captured, but I think is a huge area for future growth. Let me see. Okay. If your state has no EVV, what is the deadline for implementation? Well, that's an interesting question because states are required to have this now. So if your state doesn't have EVV, they are probably currently incurring some degree of an FMAP reduction. But it's at the state's discretion as to when to determine their own deadline for implementation, knowing that they are taking a financial hit. Of course, all of the state offices are working closely with CMS, and I know there are some states where CMS is doing everything they can to be supportive of that state's needs. So there might be some arrangement worked out in certain situations that allow for a little more time for phased rollout, et cetera. But it's really going to vary state by state. But there's no easy answer to what is the deadline going to be, because it's very much up to the state. And then a question, do you know if the FMAP reduction is greater than the increased cost to FMS to carry out EVV? We don't know the answer to that, but that's going to also vary state by state. But I will say, from the small amount of evidence that we have, the cost to implementing EVV is pretty significant. But there's definitely important need to look more closely at comparing those specific numbers. So really, I think that's a good point. Someone's asking, is there any chance there will be legislative change to the EVV requirement in the near future? It's very difficult in this day and age specifically to really gauge what is going to be happening with Congress. But I will say in the last year or so, there was some movement for a what's been called Cures 2.0. The 21st Century Cures Act, which requires EVV, is a very expansive piece of legislation. The EVV component is basically almost a footnote in a much larger piece of legislation that looks at a lot of different public health efforts. So there is a draft Cures 2.0 legislation that would address a lot of lessons learned, new funding sources for all kinds of health-related investments. And there has been some proposed language around changing requirements to EVV and Cures 2.0. But as of recently, I've seen basically no movement on Cures 2.0, and it's hard to say when or if that might recommence. I know that I've heard from advocates who are more involved on this side of things that specifically House Republicans had some resistance to making any changes to the current status quo for EVV. Another question. Have you heard of any states that did not opt to go with live-in exemption initially, but are now reconsidering this as an option? I can't think of a specific example, but I certainly, with live-in, but I'm very aware that certain states have been, just out of necessity, really been revisiting some of the decisions they've made and setting up EVV because, live and learn about what works. So I think in any given state, every state's going to have their own history in terms of developing these requirements, their own challenges to changing requirements, but it certainly is something that is possible to change if there is an interest in making that happen. Will the report be publicly available? Yes. So we will be, you have access to it right now in the room. It might have a few minor changes before it goes out to the greater public, but probably what we'll be doing is in the short term, very soon, sending it out to Applied Self-Direction members. And then sometime next week, it will go out to our broader mailing list. So anyone can have access to this report, and you can make use of it to share with any state MCO or anyone you think should hear from kind of the FMS perspective on what will make EVV work better. I see our questions are slowing down a little bit. Let's see. There aren't any additional questions. I'm going to go ahead and just say thank you again to everybody for joining today and being part of this conversation. I hope that you will find this report very helpful on behalf of the FMS Policy Workgroup. I know people are hopeful that you will use this in ways that help improve EVV implementation. And thank you again to all of our FMS members and providers who really lent their time, expertise, and made it so that we could provide these excellent recommendations. So thanks, everybody, and take care. We'll see you at the next session.